Hey there, fellow Americans! Tonight, we're diving into the nightmare of prescription drug pricing. But there's hope. A new bipartisan bill called the Pharmacists Fight Back Act. Finally, something both sides can agree on, besides loving their mothers and hating Mondays. Now you might be thinking, John, I already struggle to understand my cable bill. How am I supposed to wrap my head around this pharmaceutical mumbo-jumbo? Don't worry, we're going to break this down like a pharmaceutical executive explaining their exorbitant salary. The gist is this. Prescription drugs cost a lot, and it's not just big pharma raking in the dough. There are these shadowy middlemen called pharmacy benefit managers, or PBMs. They're supposed to be negotiating lower prices for us, but it turns out they've been playing both sides, screwing over patients and pharmacies alike. The Pharmacists Fight Back Act aims to bring transparency and lower prices for consumers. All right, let's talk about these mysterious PBMs. Imagine a used car salesman who also happens to be a health insurance agent. They tell you they're getting you the best deal, but they're also getting a kickback from the dealer. Sketchy, right? That's PBMs in a nutshell. These companies act as intermediaries between drug manufacturers, pharmacies, and health insurance plans. They're supposed to negotiate lower drug prices and create formularies, which are lists of covered medications. But PBMs operate in secrecy, shrouding their dealings in mystery and complex contracts. They engage in spread pricing, charging health plans one price and reimbursing pharmacies a much lower price, pocketing the difference. This lack of transparency has led to accusations of price gouging and unfair business practices. Some critics argue that PBMs are actually driving up drug costs instead of lowering them. So what exactly does the Pharmacists Fight Back Act propose to do about these PBM shenanigans? It aims to inject some much-needed sunlight into this murky industry. One of the key provisions of the bill is to ban spread pricing. No more pocketing the difference between what they charge insurers and what they pay pharmacies. The bill also seeks to increase transparency around PBM formularies and drug pricing negotiations. Think of it like getting itemized receipts for your medications so you can finally see where all your hard-earned money is going. The bill also wants to prohibit PBMs from engaging in other shady practices, like requiring patients to use specific pharmacies. It's like telling those PBMs, look, we're onto your game, so cut it out. This bill is a step towards fairer drug pricing and transparency. Section 4. Pills, Profits, and Politics. A brief history of battling Big Pharma. Now, you might be wondering, if this problem is so bad, why is this the first time I'm hearing about it? Well, you're not alone. The fight against Big Pharma and their PBM cronies has been going on for years, but it's often overshadowed by other political battles. There have been previous attempts to rein in PBMs, but they often get bogged down in the legislative quagmire. It's like trying to navigate a maze made of red tape, lobbyists, and campaign contributions, but this time feels different. Maybe it's the fact that both Democrats and Republicans are fed up with sky-high drug prices. Or maybe it's just that we've all had enough of being ripped off by these shadowy middlemen. The Pharmacists Fight Back Act represents a renewed push to finally hold PBMs accountable. It's a classic David versus Goliath story, except David has a bipartisan bill and a whole lot of angry constituents. Section 5. Relief at the register, hopefully. How the bill could impact patients and pharmacies. Okay, so we've covered the who, the what, and the why of this whole PBM saga. But what about the so what? How will the Pharmacists Fight Back Act actually impact you, the average pill-popping American? Well, if all goes according to plan, you could see some sweet, sweet relief at the pharmacy counter. No more wincing as the cashier rings up your monthly supply of heartburn medication. The bill's proponents argue that by banning spread pricing and increasing transparency, it will lower drug costs for patients and make medications more affordable. They also claim it will level the playing field for independent pharmacies, which have been struggling to compete with PBM-owned mail-order pharmacies. Of course, the PBM industry is singing a different tune. They claim that the bill will stifle innovation and limit patient access to medications. But this time, lawmakers seem determined to fight for patients and pharmacies. Section 6. Leveling the playing field, maybe. The national average drug acquisition cost. Now, let's get into the nitty-gritty of how this bill actually plans to lower drug prices. One of the key mechanisms is the introduction of a new reimbursement model based on something called the National Average Drug Acquisition Cost, or NADAC for short. Basically, NADAC is a more transparent and standardized way to determine how much pharmacies get reimbursed for dispensing medications. Instead of relying on the secretive and often manipulated prices negotiated by PBMs, NADAC would use real-world data on what pharmacies are actually paying for drugs. The idea is that by tying reimbursement rates to actual acquisition costs, pharmacies will be fairly compensated for their services, and patients won't get stuck with exorbitant out-of-pocket costs. It's a win-win, unless you're a PBM who's used to making a killing off of opaque pricing schemes. And hey, if it means we can finally afford our blood pressure medication without having to sell a kidney, then we're all for it.